So I was diagnosed with scoliosis in elementary school, and they watched it every 6 months. So every 6 months I went to the doctor, they checked my degrees, but it didn't get over 11 degrees, which is pretty mild. And by the time I finished high school, I was down to 7 degrees. So they said, you don't need to check it anymore. Looks like you're fine. You know, you're through puberty, you should be fine. But at the end of high school, I was in a very bad car accident and I broke my lower back. And since that moment, I've had severe back pain, severe back problems, multiple surgeries, multiple, sets of medications I've been on to alleviate the pain, and not a lot has worked. While I was focused on that, I guess the scoliosis started creeping in because of the instability in the bottom. So I went and got a checkup for my shoulder, and I looked on the x-ray. I said, that looks pretty squiggly, like my spine was very crooked. So I was like, I should probably, look at that.
Many adult patients come in seeking care after an injury like a car accident or a fall, and sometimes they discover they have scoliosis. Now in Amber's case, she actually knew she had scoliosis, a mild scoliosis, and there is one theory of causation, even in adolescent scoliosis, that it could be trauma related. Some kind of adolescent trauma or some type of childhood, juvenile trauma, even birth trauma could be associated with some causation. But after adolescent scoliosis starts and then we're in the adult stage, trauma can worsen scoliosis because it's an injury. And anytime you have an injury on an asymmetrical spine, it can cause more pain, cause more dysfunction, and it's less resistant. The spine itself is less resistant to forces because of the scoliosis itself.
I get very few moments of reprieve where I'll just roll over in the right position, like, oh, that felt so good, and then it's gone, and then it's back to the pain. So it's been mentally exhausting, extremely exhausting. I've been depressed. I've had serious mood swings because of it. My pain has become very limited. I'm lucky that I can still work. And I can't do anything that requires you to, lift 20 pounds at your job or do this or do that or stand for, an hour at a time. I can't do it. Can't do it.
When we look at adult scoliosis, is the progressive factor or the causation that causes this curve to progress is gravity. And gravity is relentless. It's just constantly pushing down on an asymmetrical spine, causing slow and steady progression throughout somebody's entire life, and it continues to increase its progressive rate as patients get older, and gravity has a greater effect. And they're wondering why they're getting worse and worse and worse as the years and years get by. So they go like, what do I do? And as they go to doctors and surgeons, they almost discount the scoliosis because there's nothing they can do about it, which is completely wrong. There is stuff they can do about it. They're just not trained properly to actually take care of them. So patients lose a tremendous amount of hope, and they feel like I was going to be living this way my entire life because they can't find a solution.
So I moved here to Florida in the Orlando area, and then I ended up looking up spine places in the area because I needed a new back doctor, and I found the Clear Scoliosis Institute. And so I had an appointment with Dr. Tony, and we did all the assessments, and my scoliosis had greatly increased just in the past. Since I had that last x-ray done on my shoulder, it was up to almost 30 degrees in both directions, which is a huge jump for someone my age. I'm in my late 20s, so that's not typical. I decided to do the rehab with Dr. Tony because he had this great plan laid out to help me with my pain. And at this point, I've been so desperate for someone to actually help me rather than just send me to physical therapy and send me back home. I felt like I couldn't have any hope going into this because I've had that before and I was devastated when it didn't work. So I kind of went into this telling myself, don't be excited if nothing happens, just do it, work through it, see if you can get some progress out of this.
So with Amber, we did a completely different treatment plan than everything that she's done before. Everything she was doing prior was something I call long and slow. It's a little bit of treatment over a very long time. Low dose, long duration. This low dose, long duration treatment is not very effective for scoliosis because scoliosis isn't an injury. That's the way you treat an injury. We invert that model. We do something called intensive care, where it's just a high dose, short duration treatment to reduce the curve quickly. So instead of a patient getting 20, 30 minutes of therapy, they're getting 6 to 8 hours of therapy for 10 straight days. And it's literally condensing 6 months of rehabilitation and therapy into 1 to 2 weeks. In this, we get a very rapid result, and then we stabilize after.
So I have done many different types of physical therapy with physical therapists, and that seems to have been the most productive so far to just get you out of that immediate pain, but there's a limit to that. Here, Dr. Tony's actually trying to get you out of pain permanently and actually stabilize your back again. And your back is so important because it's connected to everything. And he's really addressing all of that cumulatively, which is extremely, extremely helpful. So he gave me a neck brace, and that's really comfortable. It's really helping. I get to wear it at home. For someone like me that's had a bad back, slumping over felt better because my back was not strong. Retraining that through all the machines is really, really helping me.
Particularly in the cervical spine, there is something called a cervical lordosis, and everybody should have one. It is a normal finding. However, when scoliosis patients, we find that they have something called either a hyperlordosis, they've lost some of the curve, or even worse, a kyphosis, where it's physically bending the wrong way. So we use therapy and rehab and treatment and adjustments in the clinic like we would use for their scoliosis for the cervical spine, but then we also would brace the cervical spine for short duration. It's not long-term bracing like, 20 hours a day. It's 20, 30 minutes once or twice a day to help restore and stabilize that correct curvature or the lordosis in the spine to help them with what they're feeling, because that can help improve their pain and their postural alignment.
So I feel the effects, and then Dr. Tony also showed me the effects with x-rays and the degrees. It's less than half of what it was before, which is fantastic. That's just 2 weeks of work. That's great. So, before I've had doctors try to work on me for months and months and months and months and get, no progress. Just being able to be free and have my body back, have my health back, it feels so good.